Could medically administered ketamine be the cure for PTSD? The following video does not glorify the use of drugs. It is also not graphic since it does not show the consumption of any illegal substances or legal substances. The following video is strictly educational. Popularity of ketamine clinics in Florida has aroused the concern of some doctors, who are worried about the possible side effects. Ketamine is an anesthetic that can cause hallucinations and other adverse reactions when used recreationally. The drug also carries a high risk for addiction if often abused over time. But many still think it's worth trying to see if ketamine could be the cure for PTSD. Ketamine clinics becoming popular in Florida. Ketamine is administered in Florida medication-assisted treatment clinics under the supervision of medical professionals, usually targeting patients who are addicted to opiates. What separates these ketamine clinics from other facilities is that they offer the drug infusions to their patients on an ongoing basis. 2 of these clinics are currently open for business in Palm Beach County, and another one is set to open in the following weeks. The doctors at these clinics work with a doctor-patient network that is spreading across Florida and offering ketamine treatment as an option for patients dealing with chronic depression and PTSD, among other conditions. Many argue that prescription drugs like Prozac and Paxil often take months before they start working or show any improvement to symptoms, while ketamine can work much faster. Experts say the drug could have the same antidepressant effects as ECT, which requires surgery. But according to some professionals, this type of treatment is still in its early stage and should only be used as a last resort. History of ketamine. Ketamine was first developed by Parke-Davis Pharmaceutical Company in 1962 as an alternative to PCP. It was used as a child anesthetic for its fast-acting effects during the Vietnam War, but it wasn't until 1970 that doctors started using ketamine to treat depression. According to Dr. Carlos Cerati, who conducts ketamine research at the National Institute of Mental Health (NIMH), patients with major depression were treated with sub-anesthetic doses of ketamine and showed significant improvement in depressive symptoms 1 day after receiving a single infusion. Dr. John H. Crystal, chair of psychiatry at Yale University School of Medicine, also conducted research tests on how ketamine can help relieve patients' suicidal thoughts. He found out that up to 70% experienced reduced suicidal ideation even after 24 hours. Some scientists urge doctors to go beyond ketamine and develop a new drug that works better than existing ones. But others say this would be difficult to achieve, as ketamine is thought to provide relief by acting on receptors in the brain that are involved with regulating consciousness, which may not be an area for drugs developers to target. Ketamine effects. Prescription medications like Prozac and Paxil can take months before they start working or show any improvement towards symptoms of depression, while ketamine can work much faster. According to Dr. Michael Bloomfield from University College London, to have people feeling better so soon after taking a drug is unusual. However, what concerns professionals about ketamine's effects is the fact that ketamine was first synthesized in 1962, and it is a drug that is used for general anesthesia. In the 1960s, as well as the early 1970s, ketamine was being studied as an analgesic for those with chronic pain. It has been used as a painkiller, but has also been known to have hallucinogenic effects when used recreationally. In some parts of Europe and Asia, ketamine is prescribed in a different form that does not come in a liquid solution. It is an injection that can be administered on a less frequent basis after surgery, for example. Ketamine clinics in Florida. 2 ketamine clinics are now open in Palm Beach County, Florida. Palm Beach Gardens Recovery Center has been open since 2015, and it is the first clinic of its kind to offer intravenous ketamine treatments throughout acute withdrawal sessions. The doctors at this facility said they have worked with more than 100 patients who have gone through their program, which lasts about 6 months. The treatment costs $2,500 per month, and insurance may cover some of these costs. An addiction recovery center called Castle just opened up their own ketamine for opioid addicts as well. Dr. Eric Lavanas, an associate professor of emergency medicine at the University of Colorado School of Medicine, warns that even if ketamine has shown some promising results in clinical testing for treating pain and depression, not all patients may get the same benefits. There are certain findings that people with major depressive disorder or bipolar disorder may respond better to ketamine than other folks, he said. Many patients still complain about hallucinations they experience while under the influence. However, this is something new clinics like Palm Beach Gardens Recovery Center try to cap by limiting each infusion session to 30 minutes, unlike how it is administered when used for anesthesia, which can last hours on end. The procedure for administering ketamine looks simple enough. Doctors inject a needle full of the drug into a vein in the forearm, and then wait for the designated amount of time. It's not just addicts who can benefit from ketamine treatment, as it has been used as a club drug as well, particularly among those who want to go out dancing all night long. The Florida Recovery Center also said it would only limit the number of infusions given each month, so patients still have enough to last them throughout their addiction recovery process. Although many research studies show that intravenous ketamine infusion for depression works, there is a lack of evidence supporting long-term benefits. This means that doctors should be wary about prescribing this type of treatment before they know what its effects may be if taken over an extended period. Ketamine in animal studies. Animal studies show that ketamine can disrupt memory processing and make the brain more susceptible to drug cravings. However, most doctors say ketamine sessions do not create addiction, although it does rewire the brain's reward system. Doctors who prescribe this treatment for depression also face scrutiny, as there is a lack of proof that it can work long-term, and that patients do not use this as a way to self-medicate their symptoms rather than seeking actual psychotherapy with a mental health professional. Although some clinics like Castle use low doses of the drug in order to limit any possible effects, such as hallucinations, Dr. Lavanas says ketamine may be dangerous if with other opioids or benzodiazepines, which put users at a higher risk for overdose. You don't know what you're getting, he said. If this is your one and only stop, maybe it's okay, but if you're going to continue that behavior or mix it with other prescription substances or street drugs, then that becomes a problem. It should be noted that, while the two clinics in Palm Beach County offer ketamine sessions throughout opioid addiction recovery, they do not require their patients to even use opioids when taking part in treatment programs. This means there are no negative results from the patient breaking their sobriety by using these drugs after leaving the facilities and starting new lives without heroin and other unnecessary painkillers. Also, Florida Recovery Center says ketamine treatment effects may vary from person to person. It's been a problem in Florida, said Dr. Lavanas when asked about the potential dangers of using ketamine when recovering from opioid addiction, especially if it's taken with other drugs. We know that people mix ketamine and opioids and other kinds of sedative-type medications, and that can be really dangerous. Dr. Lavanas added, there are certain findings that people with major depressive disorder or bipolar disorder may respond better to ketamine than other folks. He also notes that dosage is key, particularly when patients take this drug during the ongoing depression. However, he warns patients about any side effects, such as hallucinations while under the influence of the drug. In those people who have a history or a family history of mental illness, that's an issue, he said. That then needs to be sorted out by a clinician and a patient to determine whether ketamine is going to be safe. Please like and subscribe to Medicinal Daily channel and click the bell icon to get new video updates.